In this video we are going to talk about how much you can gain with the surgery, with the augmentation surgery of the penis, in the sense of enlargement and in the sense of thickness. In the sense of enlargement, everything depends on how is your anatomy. I mean, according to your body, I'm going to start the surgery doing a flap, a skin flap. You have several videos about the flap, because we need to gain skin in the penis if we want to achieve a real result when the penis is relaxed and when it's erected. But the thing is that how much we can gain. So, at the beginning of the surgery, while I'm starting to divide the suspensory ligament, I'm going to make your penis get erected like this or like this, depending on how your penis is. And we are going to start to divide this area where is the suspensory ligament. As soon as we divide the ligament, the penis, the inner part of the penis, is going to get out very slowly. Few centimeters each time we cut. But as soon as this happens, the penis is going to start to go down and down and down. We have to stop before we arrive to 90 degrees with your body. I mean, this part. If we start with a penis like this, we cannot finish like that because we want to achieve a better result in the sense of enlargement. We need to achieve a very good result, but in this part, because if not, when you are going to practice sex or you are going to use your penis even for pee, the relation between the bone and the penis is not going to be natural one, so it's not going to work properly. At the end, what we have to do is to start the surgery doing this to your penis, getting this erected. We use prostaglandin, we put this into your penis, we get this erected, and we start to divide the ligament until this part. The other thing that is super important when we divide the ligament is that sometimes we find vessels inside the ligament. These vessels are related with the pump, that is the muscle of the penis. I mean, for having an erection, you need blood inside the penis. This is sent to the penis by the muscle. And some vessels go inside the penis or inside the muscle and are the ones that allow the penis to get erected. So, if while I'm doing the surgery, while I'm dividing the suspensory ligament, I find big vessels, I cannot remove them. Sometimes, most of the times, we can put them apart. I mean, we focus on them, we make a flap of the ligament with the vessel inside, and we put in the lateral part of the ligament. But we cannot divide this part. And this doesn't allow me to arrive to the best result in this patient. It's not very common, about a 1% only, but I prefer to talk this from the very first moment, because I want my patients to know which result we can achieve, to be real in the results, okay? About that, I think that the medical information is perfect. Your question is going to be again the same, at how much? Depends on the anatomy, but the average is between 5 centimeters to 8 on relaxed position and on erected position, on both of them. At the beginning I used to say, I mean, a few years ago, I used to say that when it's relaxed it could be 4 to 8, and when it's erected a few less. But with my patients that have the surgery about 3-4 years ago, now the results, we see that the stem cells are increased with the thickness and all that, and the pump is working, the muscle is working super okay. So they achieve even better centimeters when the penis is erected. So what we gain is the same, because we are going to make more skin, to make more penis and more muscle. We are putting the 3 parts of the penis, so the result usually is very good. We are going to be between that. This doesn't mean that we don't have patients with only 1 centimeter or with 12 centimeters. You can see the results in our website. And this depends on how the muscle is, on how the penis is, and especially on the relation, as I told you, between the penis and the bone. Anyway, at the end, our goal is to make your penis the biggest, I mean, as big as possible, but without damaging it and without having problems in the future. We want your penis to be the same, but bigger.